Hi everyone, I am Marie Bosslett. I'm an editor at Dermatology Times, and we are here live in beautiful Miami, Florida for Winter Clinical, and I'm here with Dr. Rosso. It's nice to be away from the snow.
Nice to be away from all that snow. Thanks for having me today.
Thanks for being here. We're so excited. We are going to do some rapid fire questions. Are you ready?
Rapid fire, fire away.
Who is a speaker here at Winter Clinical Miami that you would refer any patient to?
So I'm going to take the liberty of breaking that down a little bit.
Okay.
A senior dermatologist that has a lot of experience and I think is just a brilliant dermatologist is Dr. Mark Lebloff from Mount Sinai, and I know a lot of people would certainly agree with that. Pediatric dermatology, Lisa Swanson. Lisa Swanson is just phenomenal, and I have a lot of respect for her. There are many good ones, but speaker at this meeting would be Lisa Swanson. And then a young gun coming along, I'd have to say Dr. Diego Ruiz de Silva, who I'm very high on. There are some others. I'm going to give an honorable mention to Dr. Nick Brownstone, who's at Mount Sinai. But to me right now, it would be Diego Ruiz de Silva. And the great pleasure of having a program this year.
Yeah, those are some great picks.
They are great picks.
Yeah.
There are other people, but those are my picks.
Perfect. What is one label ingredient that makes you think, I'm not sure?
So I'd have to say one that I learned about from Dr. David Cohen, who does a lot with contact dermatitis, that I then heard about from other people, is betaine, or cocamidopropylbetaine, which is the no tears in No More Tears. So it was an agent that had less irritation of the eyes as compared to other shampoos, for example. So I believe that's what they put in baby shampoos, because they don't want to burn the eye. And it's reasonably important in causing contact dermatitis. So that's one ingredient I look for. They might just call it betaine, and I believe there's a couple of other names, I don't recall them, that if you see it there, it may be the cause. So the scalp may not be breaking out with itching,
right,
but when it rinses on the face, you can get a facial contact dermatitis. Yeah. That's one I look for.
Interesting. What's a condition or a disease state that you want to see getting some more attention in 2026?
So I guess I'm on the bandwagon for a lot of them, the chronic diseases, because 90% of my career, I did not have these therapies that people graduating now, getting patients miraculously better. Things like severe alopecia areata, where we struggle to be able to grow hair and use something chronically and keep the hair. Vitiligo, even though it's tougher, we now have better treatments. Psoriasis and atopic dermatitis certainly do, and hidradenitis suppurativa. But hidradenitis suppurativa, to me, is one that they all create difficulty, but that is such a painful and obnoxious condition physically. Not that the others aren't, but that's the one that I would have to say would be number one.
Great
I
answer.
really want to get. It's a tougher disease too, I think, understanding in terms of the mechanisms, but we're getting better and better, and that's one that I would have to say that's the number one of all those I would fight for.
For sure. What's a piece of advice you would give to your resident self?
So I'd have to say for myself, because I always knew that I certainly wanted to practice dermatology, I didn't realize how much surgery I could do when I went into dermatology. And so I did do a Mohs surgery fellowship, so I did a lot of medical dermatology, but I also knew that I wanted to teach and lecture. My parents were like that, so it was in my DNA. But I probably didn't pay as much attention in managing finances. And I think that's really, really important, because that's going to be a reality in your life. If you like to spend money like I do, you better be taking care of your finances. I'm crazy. You should see my closet. But if you, even beyond that, just more responsible things. Life insurance, once you're gone, you're not a cost. But if you're disabled, you need disability insurance, because then you're hanging around and you might not be productive. So I was fortunate to have that, but other aspects of finance, I was brainless. And I wish I would have had more background.
Some great advice. What is one skincare trend you want to magically erase?
So I'd have to say this emphasis on skincare, and skincare is always important, no matter what the age is, and photo protection and the basics, but this emphasis on appearance at especially at very young ages. I don't want to be selling insecurity to junior high school. Whether you think about that with girls being, how do I look compared to my girlfriends and all that, it affects everyone. It affects males too. I don't want them to be thinking about being insecure about themselves. I don't want to sell them that sense of insecurity. And I feel like that is happening. Where there's money to be made, people are going to do that, but I don't want to be part of that in dermatology. Help them, but I don't want to be selling insecurity.
Perfect. And then our final question, who do you want to see do this rapid fire challenge next?
So I would have to say the next person that I would think for this, that I would want to see, is my good friend, Dr. Gary Goldenberg. Because Gary Goldenberg, he's in practice in New York City. He does a lot of cosmetics. He knows medical dermatology very well, surgical dermatology very well, and he also knows business very well. So he could answer it from so many different perspectives. I don't know that there are a lot of people that realize how brilliant Gary Goldenberg is. So I would want to see him be next. I hope you get to him.
Dr. Goldenberg, if you're watching, you're next. We're coming for you.
They're coming for you, Gary.
Thank you so much, Dr. Del Rosso.
It's a pleasure.
Great.